few days. So we'll kind of bandage it up, and then you can take ibuprofen or Tylenol. The numbing stuff will last for about 3 to 4 hours, so I would take ibuprofen or Tylenol before that to try to get it in your system, and then the next few days you'll probably want to take that pretty consistently.
I will do it. I have a question. Well, but I have to go to work, so
When do you work today?
Sunday
Sunday.
night.
Sunday
Sunday
night.
night.
I think you should be okay to
Okay.
go on Sunday night. What do you do for work?
I do the hard labor. I do hard safety classes.
She puts together trusses basically, and she wears steel-toe boots.
I see. Okay. How are you on your feet then? Pretty much all the time.
Yes.
Can you take Sunday night off?
I can try to do. I can do it.
Okay, because I think that might be a little soon to get if you're wearing steel toe boots. The problem with that is you'll sweat a lot, and I worry because you're gonna have a wound. So when do you work after Sunday?
Sunday at 10 o'clock.
Okay, and then what's after that?
10 to 6.
10 to 6. And then do you work Monday?
Yes.
When
Monday.
the
Sunday
same
through
time?
Same time.
Sunday through Thursday?
Same time.
Okay. If you could take at least Sunday off, I think you probably can go back on Monday.
Okay.
As long as you're not having any more problems with this. Okay. This is our consent form saying that it's okay for us to do it. Basically, we're going to remove, it's going to be part of your toenail. Every time we do anything to you, there's some risks to every procedure. Risk of pain. I'm going to try to prevent that with giving you nice and numbed up, but you'll probably have pain afterwards. There's a small risk of bleeding. Usually this doesn't cause a whole lot of bleeding, but in rare cases I have to try to get the bleeding to stop with kind of a little chemical thing we put on there. Risk of infection. You already have an infection, so there is a risk it could get worse. That's why I'm going to give you antibiotics afterwards. And then you can have this happen again to you. I'm going to try to actually kill off some of the nail that's ingrown to try to prevent it from happening again, but it can always come back. So there is that risk. The other thing is sometimes your nail will grow in weird, not normal. There's a risk of that. It's less likely if I'm just removing part of it. So I don't think you're going to have that problem, but there is a risk it can kind of grow back not straight. Okay.
Okay.
But most of the time what happens is I just remove it, it'll grow back a little bit here, and it just follows the rest of the nail. So I don't think that's going to happen. But do you have any questions about that? Okay. If you're okay, we'll go ahead and have you sign, and then I'm going to get you numb, and then we're going to soak your toe to try to help it soften up too.
Thank you.
You're welcome.